Hey, it's John here at Remodel Health, and I'm really grateful to have you here with us today. Maybe it's your first time, and maybe you've been following us for a while. We love innovative solutions to healthcare. We love helping you as an employer keep taking really good care of your team and cut costs as much as possible. So today, we're going to explore 4 alternatives to group health plans, and I'm really excited to show you what we got. Okay, starting at number 1, high deductible health plans, HDHPs. These are going to be plans that, you guessed it, have a higher deductible, but they're going to have a lower monthly cost. So the idea is you as an employer go to these plans, you save money per month, but that's not it. You take some of that savings and give it over to your people. Why and how? Well, these HDHPs are eligible for health savings accounts, HSAs, and you've probably heard about it. The idea is you give people some extra money to spend on the medical care they actually use instead of overspending on copay plans and all of that. The idea is also that your employees are then able to become consumers, and these are consumer-driven plans, and they can save this money over the course of time. HSA, health savings accounts. We love this as at least your first step into an innovative solution to keep taking care of your team and also cut some of your costs. All right, now let's look at number 2. This is pretty different than a copay or an HDHP, and it's the concept of a self-funded plan. Now, what I will tell you is these will not likely become advantageous for your group until you reach closer to 100 employees. We have seen them work for smaller groups, but in general, they're not. Now, the concept of self-funding is pretty simple. Instead of paying for a carrier and spending a whole bunch of money on plans that may or may not be used, you simply say, let's just pay for when my people actually use that care. Now, there's a lot of moving parts. You want to get a good network. You need to have a reinsurance on the back end so you're not fully exposed to all of the expenses for your team. There's a lot of moving parts here, but the big concept is you use a third-party administrator to simply reimburse or pay for the cost of the actual care that's needed. Oftentimes, this can save costs. This can help your employees have better plans, and we would encourage you to look into this as well. And now number 3, individual coverage HRAs. We call it ICHRA. These just started in 2020, so they are fresh and hot off the presses. We would highly encourage you to check this out as a method of not just giving one plan to your people, but giving them an allowance to go spend on the individual marketplace. This can be a very meaningful experience. It also gives them the power of choice in the matter, which is pretty special. These dollars are also pre-tax, so it's a great benefit to both the employer and the employee. There are a lot of details about this, so I would encourage you, check out the link below, but definitely look into this brand new alternative to group health plan. And lastly, I want us to look at Remodel Health's exclusive solution. So number 4, wage up. IRS Notice 2015-17, and feel free to check that out if you would like, allows for employers to give more pay instead of health benefits to their people. So why would you want to do that? Well, the first thing is it unlocks those tax credit discounts on individual insurance products. Very valuable, but it also lets your people use that budget to go on their spouse's plans. And even if there's a spousal carve out, they still can. Very valuable. And then lastly, you can use that money towards sharing ministries. It is a growing and a very popular solution here in the United States. So we would encourage you, look at the wage up model along with high deductible, self-funded, or ICHRA for a solution to keep caring well for your team, but also cut costs. Remodel Health over the past 3 years has helped employers save $23 million on healthcare, and we would like you to join us as well. So with all of that said, we would like to invite you, run your own free estimate using our online calculator tool. You can use the link below. You can also go to our website. If that keeps you interested, we would love to chat with you personally. Our benefits consultants would love to run a free full analysis on you and provide you the full spectrum of alternative solutions for how you can keep taking care of your team and also cut costs. So until next time, we invite you to continue to rethink employee health benefits, and we'll see you again next time.